All right, so let's talk about access to healthcare first. If I said, oh, you have an all access backstage pass to this Kevin Gates concert, that means that you can get to him. Now, you may not be like as close as you want, but you can be close enough, right? And so when we talk about access to healthcare, we're talking about you're able to get to a healthcare facility and get the care you need. Does that make sense? Okay, so that's access. Now, what can happen is, well, several things, and when we'll talk about them. Access to healthcare may be an issue in the near future, and it's because of several reasons. One, a lot of healthcare workers are retiring. So we got the baby boomers, which make up a good chunk, maybe even half of the current workforce in healthcare, especially when we talk about nursing and medicine. And so if we don't have practitioners, where are these patients going to go? Like if y'all think about a perfect example is medical specialists here in Waynesboro. Those are great. A lot of them are great, really good doctors, but they're going to be retiring eventually, right? They can't practice forever. Then it's like, how do we fill those voids? How do we get people in to come to Burke County, small rural area where they may not make as much money as they would in a larger city? How do we get those practitioners to come to us? And so if we don't have practitioners, how can our citizens go to the doctor? All right, so access. All right. Second thing, Affordable Care Act. Oh, well, I'm going to skip to the third bullet because I kind of talked about it already. It's difficult to find a care provider, especially in rural areas. I don't know if y'all know this or not, but in Burke County or Waynesboro, we do not have any board certified. And remember certification, we talked about that with career levels and all that. Basically the best of the best. I know myself in this area, we have no board certified OBGYNs in the whole county. And so that can put our patients and their babies at risk. And that is something that we got to fix. We got to try to fix that. That's just one example. All right. So your access, if you're a pregnant woman in Burke County, how will you get care? Like if you don't have a transportation for like to get to Augusta for care, like how would you work that? How would you make it to your appointments? What do you do? Right? They're doing a bit Vice Network. I don't know if you ever heard of Vice Network, but they do a lot of documentaries and stuff. They did one about the case in Augusta recently, but they're doing one on that, on basically maternity fatality, like basically moms not having access to health care and it costing them their lives when they're pregnant. And that junk is like, it's really good. Like, it's going to be great. It's going to be amazing. I can't wait to share it with y'all because that's a big issue. But anyways, back to the concern is access. So these women don't have access to OBGYNs, and that has a negative impact on their health and their lives for some of them. Then with the Affordable Care Act, there are millions of Americans who didn't have access to health care before, but now they do because it helps them pay insurance costs. And so that can put a strain, right, on the practitioners that you already have. So if I already didn't have enough practitioners or enough specialists in my area, and now there are like 30,000 more people who now have health care, it can be good for the money, but that's going to be really difficult for the healthcare facilities to try to keep up with the demand for patients coming to the doctor. Does that make sense? Okay, so that's access. So we got to work on making sure we have enough workers in order to meet the needs of our patients in our community.